Hi, I'm Dr. Parks, and this is my kitty Finnegan. Today we're going to do a demo on how to correctly administer insulin for a diabetic kitty. The first thing to note is that the kitty should have had a meal, unless otherwise directed by your veterinarian, prior to insulin administration. The other thing to mention is that we should make sure we keep the insulin in the refrigerator. We recommend not keeping it in the door, but actually inside of the actual refrigerator to ensure that the insulin is kept at an appropriate temperature. So the very first thing is there are many different types of insulin. So this is one type that we often use in kitties. And this particular insulin requires U40 syringes. It's important to ensure that you have the correct syringes based on the type of insulin and make sure that you're following your veterinarian's recommendations. So after we take the insulin from the refrigerator, it's important to not shake the bottle. To resuspend the solution, I recommend rolling gently like this. Now to draw up the insulin, since this is an unopened bottle, I'm going to demonstrate on a saline bottle. The first thing, so before drawing up the insulin into the syringe, you need to make sure that you remove both protective caps from the syringe. The other thing to note is that every time we should be using a brand new needle and syringe. This is to decrease the risk of infection to your kitty as well as decrease pain, as the needle gets dull every time it's used. So to demonstrate this, I'm going to use a bottle of saline. I invert the bottle, place the needle into the bottle, and draw back to the desired units. For this demonstration, I'm going to be using 5 units. Then you remove the needle from the bottle. Make sure your kitty is nice and comfortable. Sometimes it's helpful to have a helper. I gently tent up the skin, kind of pinch it a little bit to desensitize the area. And then I kind of poke in between the tent to find a good loose spot. Poke into the fur and in through the skin. I draw back on the needle. And if you get blood in the needle, you want to make sure that you pull out and try again. If there's no blood, you can go ahead and inject. And then it's important to recap and dispose of the needle immediately in an appropriate sharps container. And then we want to make sure that we're reinforcing this adventure with a snack. There's a lot of ways to give insulin to kitties, but this is a way that we have found that works really well for all of our feline patients.